Any difficulty in study? Relax. Dental Rupam is here. Today chapter is Osteology of Skull. Basically, details of Osteology of Skull were seen in the human anatomy, but in oral anatomy, some basic structures or basic details are present in Osteology of the Skull. So we must know about the some basic importance statements about the Osteology of the Skull. So let's read it. Overview. The human body is composed of 206 bones. Bones can be classified in general on basis of location into axial skeleton and appendicular skeleton. On basis of shape, bone classify into flat, tubular and irregular bone. On basis of size, bone classify into long and short bone, and on the basis of histology into compact and cancellous bones. The bones of the ethmoid constitute the cranial bones, where nasal, zygomatic, palatine, lacrimal, vomer, maxilla and mandible consist of facial bone. There are two groups of bone. One is the facial and others is the cranial. Cranial consists of ethmoid, frontal, occipital, parietal, sphenoid, temporal, and facial bones consist of inferior nasal concha, lacrimal bone, mandible, maxilla, nasal bone, palatine bone, vomer and zygomatic bones. Bones process reach vascularization via the endosteal and the periosteal vessels. Introduction. Osteology is the study of bones. The bone is a calcified connective tissue that forms the basic unit of human skeletal system. It is the great importance for various physiological functions such as following. One is support. Bones provide the hard structural framework to support the other structures of the body. Protection. Bones protect the vital soft inner organs. Movement. Bones in coordination with the muscles aids in location there from movement. Electrolyte and acid-base balance. Bones maintain the electrolyte and acid-base balance. Next, blood formation. Bones contain red bone marrow, which is the main site for the synthesis of blood. Storage of minerals. Minerals such as calcium, phosphorus, which perform vital physiological function in the body are stored in bone. Fat storage. The yellow bone marrow in some bones is one of the site of fat storage. Classifications of bone. Before I go to the classification of bones, some osteology related terminology is here. Those are first is canal, a long passage which bone that transmit blood vessels and nerve. Foramen, a natural opening or perforation through the bone that permits transit of blood vessels and nerves. Fossa, a hollow or depressed area on the surface of bone. Notch, a curved depression or indentation, pit, groove and fissure. Depression that serve to increase the extent of surface for the attachment of the ligament and muscle. Ridge, crest or line, a narrow rough elevation extending to some distance along the surface. Spine, a sharp cylinder pointed eminence. Sulcus, a groove, a cervix or furrow present on a bony surface meant for attachment of soft tissue or to the housed delicate structures. Tubercle, a small round prominence. Tuberosity, protuberance or process, a broad, rough or uneven elevation on bone called tuberosity. Now go to the topic classification of bones. Bones can be categorized on the basis of their location, shape, size and structures. On the basis of location: axial skeleton, appendicular skeleton. Axial skeleton, bones that occupy the central position of the skeletal system. Examples of bone of skull, vertebral column, sternum, ribs, those are axial skeleton. Appendicular skeleton, bones that occupy the lateral portion of the skeletal system. Example: bones of the pectoral girdle, pelvic girdle and limbs. On the basis of shape: flat bone. Examples is bones of skull, sternum, pelvis, ribs. Tubular bones. Example: bone of limbs. Irregular bones. Example: bones of face and vertebral column. On the basis of size: long bone, short bone. Long bone, bones that are tubular in shape. Examples: bones of limbs. Short bone, bones that are cuboidal in shape. Examples: tarsal bone in the feet. On the basis of histology: compact. Example: cortical part of long bone. Cancellous. Example: narrow of long bones. The adult skeleton system compressed nearly 206 bones. It is less when compared with the actual number of bones present at the birth, which is approximately 270. The reduction in number is due to the fusion and ossification that occurs during the bone developed phase since birth. In this chapter, we are deal with the study of bones that constitute the head. The bones of region, the front part of the axial skeleton, which support and protect the organs of the head and neck. The skeletal unit of the head is called skull, and it is made up of 22 bones. It is anatomically and functionally subdivided into the following. One is anatomical. On the basis of anatomical region involved, the bones of the head are classified into followings. One are cranial bones and others are facial bones. Cranial bones. Those are bones that are comprised the brain, cause, and cranial bones are 8 in number. Cranial bone in 8 in number, those are ethmoid bone, frontal bone, occipital bone, parietal bone, sphenoid bone, temporal bone. Facial bone. Those are bones that compress the face, and facial bone are 14 in number. Functional classification. Bones have specific functionality, individuality or collectively, and are the classified into followings. Neurocranium. It is the bony covering of the brain, and related structure consists of 8 bones, namely the frontal bone, parietal bone, occipital bone, the sphenoid bone, the ethmoid bone, and the part of temporal bone. It is the further divided into following: roof and floor. Roof compress frontal, parietal, temporal, occipital, and floor is compress the orbital process of frontal bone, sphenoid, ethmoid, pectoralis temporal, and the occipital bone. The second classification of the functionally classification, viscerocranium. These bony covering surrounded the oral cavity, pharynx, and upper respiratory process, and compressed of 14 bones. Now go to the individual bones and its details. At first, cranial bones. Cranial bones perform the vital function of the protecting the brain. which is the main center for motor and sensory coordination. They also provide area of attachment for muscle that move the head in different direction. The bones of skull roof are separated by region of dense connective tissue called frontally during birth. They are 6 in number and are fibrous and movable. With growth, the connective tissue of frontalis is gradually replaced by the interdigestion between the adjacent bone forms sutures. The 5 sutures of the cranium are 2 squamous, 1 coronal, 1 lambdoid, 1 sagittal. Squamous sutures present between the squamous part of the temporal bone and lower border of the lower or inferior border of the parietal bone. Sagittal suture forms between the two parietal bone. Coronal suture present between the two parietal bone and frontal bone, and lambdoid suture present between the occipital bone and the parietal bone. Frontal bone. The frontal bone is the bone of forehead and it's from the anterior roof of the skull. It extends down anteriorly to from the upper margin of the orbit. The frontal bone developed as halves which grow towards each other to fused by the age of 5 or 6 years. The suture persistence beyond 6 years is called metopic sutures. The frontal bones contributes to the superior orbital margin, a prominent bony edge over the orbit. Supraorbital foramen lies medial to its midpoint. The frontal bones also lodges the frontal sinuses. Frontal bones have two frontal sinus, and one foramen, that is name is the supraorbital foramen. In supraorbital foramens, transmit structures transmitted is supraorbital nerve and supraorbital artery. Next one is parietal bone. The parietal bone are paired and separated by sagittal suture. Along the superior midline, they form the sides and the roof of the cranium. The coronal suture separated the frontal bone from the parietal bone. Next one is temporal bone. The temporal bones are also paired bones which form the lower side of cranium. The temporal bones articulate with the adjacent parietal bone by squamous sutures. Each temporal bones has 4 parts: squamous, tympanic, mastoid, and petrous part. Occipital bone. Occipital bones form most of the base of the skull. It's articulate with the parietal bone at the lambdoid suture. The foramen magnum, the big foramen. The foramen magnum is the large opening in the occipital bone through which spinal cord passes to the joint, the brainstem. In either side, the foramen magnum present in the occipital condyle, which is articulate with the first vertebra of vertebral column. Next one is sphenoid bone. The sphenoid bone constitutes a part of the anterior cranial base. It consists of a central body and bilateral projection called the gaiter and laser wings that form part of the orbit. The body contains the sphenoidal sinus within and a superior saddle-like depression, the sella turcica, that houses the pituitary gland. A pair of pterygoid processes extend inferiorly from the sphenoid bone, contribute to the lateral walls of the nasal cavity. The numerous foramina associated with the sphenoid bone. The main foramina are the foramen rodentum, passes through foramina rodentum maxillary branch of trigeminal nerve. In foramen ovale mandibular nerve. Foramen spinosum middle meningeal vessel. Optic foramen, optic nerve, and ophthalmic nerve. In superior orbital foramen, structural transmitted through these foramens are oculomotor nerve, trochlear nerve, ophthalmic nerve, abducent nerve. The last bone of cranials is ethmoid bone. The ethmoid bones is midline structures that constitute the roof of the nasal cavities. It situated in the anterior part of the cranial floor between the orbits. It exhibits the following extensions: perpendicular pet. It is the downward extension that forms the upper part of the nasal septum. It divides the nasal cavity into two cavities, referred to as the nasal fossa. Ethmoid sinus. The ethmoid sinus are air-filled bone cells present in the either side of the perpendicular plate. Crista galli. Crista galli is the superior spine-like extension of the perpendicular plate protruding into the cranial cavity. It acts as an attachment for the meninges of brain. Superior and middle nasal concave. Those are two scroll-shaped plates related to the lateral wall of nasal cavity. They are also called turbinates. Cribriform plate. It is the perforated plate present in the cranial base at right angle to the perpendicular plate. The multiple holes through this plate are called foramina. Cribriform foramina, which is permit transmit of olfactory nerves from the epithelial lining of the nasal cavity. Now go to the facial bones. The facial bones form the basic structural framework of the face. In addition to the normal function of any bone, they also perform the following. First one is they protect and support the entire point of both digestive and respiratory system. Second, they provide attachment for some muscle of facial expression. Facial expression means sad, happy, angry. Third is they protect and support the organ for the sense of vision, eye, taste, smell, taste for tongue, smell, nose, hearing, hair, and equilibrium and balance. That is for brain. They define a person individuality. The facial bones are 14 in total. They are paired structures with the mandible and vomer being the two exceptions. All are paired except mandible and vomer. Next sections provide a detailed description of the individual facial bones along with relationship. First one is nasal bone. Nasal bone are two small bone, longitudinal bones, which meet in the midline to form the prominence or bridge of nose. Nasal bone protect the nares and support the palpebral cartilaginous plate, which are a part of nasal framework. Zygoma. The zygomatic bones, also called the malar or cheekbone. Zygomatic bone is a paired rhomboidal bone and is located below each eye, thus forming the lower lateral margin of the orbital cavity. An extension of zygomatic bone joined with a process of temporal bone to form an arch-like strut called zygomatic arch. Features: the zygomatic bone has 3 surface, 3 fosses, 3 foramina. 3 surface, 3 fosses and 3 foramina. Surface: facial surface, temporal surface, orbital surface. Facial surface: smooth lateral aspect of the bone. Temporal surface: curved medial aspect of the bone. Orbital surface: lateral and inferior orbital margins. Process: 3 process: frontal process, maxillary process, temporal process. Frontal process: articulate superiorly with the frontal bone. Maxillary process: articulate inferiorly with maxillary bone. Temporal process: articulates posteriorly with temporal bone to form the zygomatic arch. Foramina: the zygomatic bone contained a Y-shaped canal to transmit the zygomatic nerve and vessels. Zygomatic orbital foramen: presence on the orbital surface of the zygoma to transmit the zygomatic nerve. Zygomatico-facial foramen: presence on the facial surface of the zygoma to allow the exist of the zygomatico-facial nerve and artery. Zygomatico-temporal foramen: presence on the facial surface of the zygoma to allow the exist of the zygomatico-temporal nerve and artery. Articulation: the zygomatic bone articulate with a number of other facial bone including maxilla, frontal, temporal, greater wing of sphenoid and temporal. Next one is maxilla, important bones. They are called the upper jaw. Maxilla are pair bones which contribute to the formation of upper face, orbital floor, lateral wall of the nasal cavity, floor of the nasal cavity and roof of the orbital cavity, oral cavity. They are of great significance in dentistry and they carry the upper dental apparatus. Features: the maxilla is a hollow pyramidal structure with the feature given there we are talking about. It consists of 4 surface, 4 fosses, or there are foramina, 3 foramina, 4 surface, 4 fosses and 4 foramina and a sinus. Maxilla have a sinus. Surface: anterior surface or facial surface. This facial faces forward and is angulated laterally. It displays following features: incisive fossa. This is a small depression above the incisor from where the depression safety muscle originated. Canine fossa. This is a depression on the alveolar process lateral to canine. Infraorbital foramen. There is a foramen 7 mm below the inferior rim of the orbital that transmit the infraorbital foramen. Nasal notch. This is a curve this is a curved depression on the medial aspect of the maxilla. Maxilla bordering the nasal cavity. It meets the similar structures on the opposite side from the nasal spine. Posterior or infratemporal surface. It is the convex and curved posteriorly and laterally. The following features and characteristics. Alveolar canal. Those are foramen for posterior superior alveolar nerve and vessels. Boundary of infratemporal fossa. The posterior surface of maxilla from the anterior wall of the infratemporal fossa. Boundary of the infraterigopalatine fossa. The posterior surface of the maxilla forms the anterior wall of the pterygopalatine fossa, which locates the pterygopalatine ganglion. Superior or orbital surface. It is concave and from the floor of orbit. Medial or nasal. It's from the lateral wall of the nose and display the following features. Those are maxillary hiatus. It is a large irregular opening of the maxillary sinus. Nasolacrimal groove. It is a linear depression that become continuous with the nasolacrimal canal that locates the nasolacrimal duct. Process. Alveolar process, palatal process, zygomatic process and frontal process. Alveolar process. It is a part of maxilla that support the upper teeth. Palatine process. It is a medial extension towards the midline, meeting the maxilla of opposite side. It's from the floor of the nasal cavity and roof of the oral cavity. Zygomatic process. It is a lateral extension of the maxilla, forming the apex of the pyramidal structure. Frontal process. It is a upward projection of the bone that articular with the frontal bone. Foramina. Incisive foramen বা nasopalatine foramen. This is located in the anterior region of the hard palate, behind the incisor, and transmit the nasopalatine nerve and the blood vessels. Infraorbital foramen. This is the located below the orbit to transmit the infraorbital nerve and artery. Inferior orbital fissure. This is the located below the maxilla and the greater wing of the sphenoid. Transmitted the infraorbital nerve and vessels. Emissary veins, maxillary nerve and zygomatic nerve. Maxillary sinus. Maxillary sinus is more important sinus in our body. The maxillary sinus located within the maxilla. It is the largest of the four paranasal sinuses. It is also called the antrum of Higmore. It helps to humidify air, lessen the weight of the skull, and provide resonance to voice. It communicates with the nasal cavity through the midline meatus. Palatine bone. The palatine bones contribute to the formation of posterior third of the hard palate, orbit, and a part of nasal cavity. They are L-shaped with horizontal and perpendicular palates. The palatine bone contains the large greater palatine foramen and two or more smaller lesser palatine foramina. Lacrimal bones. Lacrimal bones are the smallest of the facial bones. They form the anterior part of medial wall of each orbit. Each bone has lacrimal sulcus that forms the nasolacrimal canal. Inferior nasal concave. Inferior nasal concha are the largest of all concha. Those are the scroll-like paired bone that protrude medially from the lateral wall of the nasal cavity and lie below the superior and mandibular concha. The bones are covered with a mucous membrane to humidify the inhaled air. Vomer. Vomer is a thin, flattened bone that forms the lower part of the nasal septum. It supports the septal cartilage that forms a part of nasal septum. Mandible. Mandible is most important in our mandible. Mandible is U-shaped bone forming the lower jaw of the face, which is unique in numerous aspects. It is the largest, strongest bone of the face and the only movable bone of skull. It articulates with the skull by paired temporomandibular joint. Features. The features of mandible are describing there are two main parts. One are body and ramus. What is the body? Body is a part of mandible extending from the canine to anterior border of the masseter muscle. Ramus. Ramus is broad superior ventral extension from the posterior part of body. Angle. Angle is the junction formed by ramus and body of the mandible, formed by inferior surface of ramus and posterior surface of ramus, and inferior surface is continuation of the inferior surface of body of the mandible. Symphysis. Symphysis is region corresponding to the midline of mandible. Parasymphysis. Parasymphysis region adjacent to the symphysis. Process. There are three processes: condylar process, coronoid process, and alveolar process. Condylar process. Rounded projection from the upper border of the ramus which articulate with the temporal bone to from the temporomandibular joint. Coronoid process. Sharp triangular projection from the upper border of the ramus that provide attachment to muscle of mastication. Alveolar process. A part of mandible that bears the teeth. Ridge. External oblique ridge and internal oblique ridge. External oblique ridge. Linear bony elevation or crest on the lateral aspect of mandible that extend from the first molar region and continued upward as the anterior border of ramus. Internal oblique ridge. Linear valley elevation or crest on the medial aspect of the mandible. Notch. Mandibular notch, coronoid notch. The curvature or depression between the condyle and the coronoid process. Coronoid notch. Depression or concavity on the anterior border of ramus is called coronoid notch. Foramina. Mental foramen, mandibular foramen. Mental foramen is present on the anterolateral aspect of the body of mandible between two premolars. The mental nerve and fascials pass through the foramen. Mandibular foramen. Mandibular foramen is present on the medial surface of the ramus. The inferior alveolar nerve and fascials are transmitted through the foramen. Fossa. Submandibular fossa, sublingual fossa, digastric fossa. Submandibular fossa. Shallow depression present on the medial surface of the mandible to locate the submandibular gland. Sublingual fossa. Shallow depression present on the medial surface of the mandible to locate the sublingual gland. Submandibular fossa and sublingual fossa divided by mylohyoid line. Digastric fossa. Depression on the lingual surface of the mandible near the symphysis manti from where the anterior belly of digastric muscles originate. Tubercle. Genial tubercle. The small bony elevation that provide attachment to geniohyoid and genioglossus muscle. Lingula. Lip-like projection on medial surface of the mandible just above the mandibular foramen is called lingula. Now go to the facial buttresses. The facial skeleton consists of region called buttresses, which are localized area of thick bone. They deserve special mention because they provide stability and strength to adjacent relativity weakens bones and protect the surrounding soft tissue. There are 3 horizontal buttresses and 2 vertical buttresses. The horizontal are the weaker than vertical. One is horizontal superior orbital limb and frontal bone, inferior orbital limb and nasal bone, and maxillary alveoli consist of horizontal, and vertical consist of zygomatico-maxillary and nasomaxillary. Now go to the articulation. Cranium and facial bones articulate with each other to form various cavities such as orbital and nasal cavities. Thank you.